WestBridge was founded by a family in Pennsylvania who has a family member who experiences both mental illness and co-occurring substance use disorders. And while they had all the resources for any type of treatment that they could find, they couldn't find treatment that treated both at the same time. So they got bounced between the mental health world and the substance abuse world. And so their family member really floundered and got significantly worse as a result of it. So they started WestBridge to help other families like themselves who really got bounced between two systems, and they wanted to have a place where individuals and families could go to heal. Our treatment philosophy at WestBridge is multifaceted. We really believe in using evidence-based practices or things that have been proven to work. We also really believe that the most important thing that we do is develop a really authentic relationship with our participants and our families, because it's really through the relationship that we engage people in treatment and that we're able to provide the hope and support that they need while also using the evidence-based practices. So we try to weave a number of things together to provide holistic treatment for our participants and families. Some of the evidence-based practices that we use at WestBridge are the ones that were developed by the Dartmouth Psychiatric Research Center, which were designed specifically for people with severe and persistent mental illness and substance use disorders. And they would be supported employment, integrated treatment for dual disorders, family education and support, illness management and recovery, medication management, which is a collaborative experience between the treatment team, the individual, and the physician. We also have assertive community treatment. We base everything we do on the Stages of Change model, which is research that was done at the University of Rhode Island. The Stages of Change model was really breakthrough research that happened in the 80s at the University of Rhode Island, where they were looking at trying to figure out how to decrease smoking, because the federal government insurance companies wanted to really decrease the long-term costs of smoking in our population. And what they found is that people go through different stages of change, and it can happen very fast, or it can be a longer process. So what they also did, which was really brilliant, is they started to look at what are the treatment interventions that would work at different stages of change. For example, if somebody's in pre-contemplation stage, that means they totally have no awareness that there's a problem. For instance, if it's alcohol abuse, then I just drink this way because my job is really bad and my family's always nagging at me. So historically, those are the people we'd send to AA or Alcoholics Anonymous or some other support group. That's an action-oriented intervention, and those folks would come back to us and say, I can't identify, or I just want to drink more. So what we've learned is that when people are in pre-contemplation, what we really need to do is educate them about what alcohol abuse is, but not send them out to do something that they're not ready to do or even believe that they need to do. So it's really been brilliant. So it's really helped us to work with folks because we're able to tailor the interventions based on what stage of change someone is in. Well, I think the other, for us, brilliant research was the research done by the Dartmouth Psychiatric Research Center on integrated treatment for dual disorders. What they've learned and developed is integrated treatment so that you're looking at both diseases are primary. A mental illness and a substance use disorder are both primary diseases occurring in the brain at the same time. It's not about the chicken or the egg, what's primary or secondary. You don't say that about asthma and hypertension. They're both significant, right? So the same thing is true with mental illness and substance use disorders. So being able to have that as really our foundation of treatment at WestBridge, and that's just really enabled us to help folks. Families are really important at WestBridge. We were started by a family. We make families an essential part of someone's treatment. If someone's family isn't willing to be part of the treatment process, then we won't admit the person. It's a cognitive behavioral based treatment. It's very much an educational and support program, but it's also providing families with the skills they need to be able to communicate more effectively, to be able to problem solve more effectively. It gives the families, I guess, permission to go back being families. And most of our families just feel like they get their son or daughter back.